Development Council, your gateway to digital transformation. We are an independent, vendor-neutral ISO IEC 1024 accredited certification body committed to helping individuals and organizations stay future-ready in a rapidly evolving world. GSDC is accredited by the Accreditation Board for International Certification Bodies, ABICB. For 10 years, we've certified more than 100,000 professionals across Europe, North America, Asia, and Africa, with our offices in Switzerland, the United States, and Singapore. Our programs are recognized by leading publications and podcasts, including Forbes, Tech Target, People Managing People. We offer 100-plus globally accredited certifications across emerging and in-demand domains like Generative AI and Emerging Technologies, HR and Learning and Development, Project Management and Agile Scrum, ISO and Quality Management, Information Security. Each GSDC certification is designed to empower professionals with confidence and help organizations stay competitive in a fast-changing landscape. Every certification is crafted with insights from 100-plus global advisory board members representing top universities and leading industry experts. Our certified professionals are trusted by 500-plus multinational companies, which help unlock better roles, faster promotions, and delivering cutting-edge expertise. We partner with 100-plus authorized training partners and 50-plus universities, supporting talent across all career levels, from entry-level to executive leadership. As a GSDC member, you gain lifelong access to interactive webinars, hands-on workshops, SME panels, and global summits. Join a vibrant community of 25,000-plus members and be part of our global events. Check our reviews on Trustpilot. We're trusted worldwide for quality, support, and impact. Whether you're aiming higher or building tomorrow's talent, GSDC is your partner in purposeful growth and impactful leadership. Visit our website to explore our offerings. GSDC, share the best practices and learn from the best practices. Welcome to the Global Skill Development Council, your gateway to digital transformation. We are an independent, vendor-neutral ISO IEC 1024 accredited certification body committed to helping individuals and organizations stay future-ready in a rapidly evolving world. GSDC is accredited by the Accreditation Board for International Certification Bodies, ABICB. For 10 years, we've certified more than 100,000 professionals across Europe, North America, Asia, and Africa, with our offices in Switzerland, the United States, and Singapore. Our programs are recognized by leading publications and podcasts, including Forbes, Tech Target, People Managing People. We offer 100-plus globally accredited certifications across emerging and in-demand domains like Generative AI and Emerging Technologies, HR and Learning and Development, Project Management and Agile Scrum, ISO and Quality Management, Information Security. Each GSDC certification is designed to empower professionals with confidence and help organizations stay competitive in a fast-changing landscape. Every certification is crafted with insights from 100-plus global advisory board members representing top universities and leading industry experts. Our certified professionals are trusted by 500-plus multinational companies, which help unlock better roles, faster promotions, and delivering cutting-edge expertise. We partner with 100-plus authorized training partners and 50-plus universities, supporting talent across all career levels, from entry-level to executive leadership. As a GSDC member, you gain lifelong access to interactive webinars, hands-on workshops, SME panels, and global summits. Join a vibrant community of 25,000-plus members and be part of our global events. Check our reviews on Trustpilot. We're trusted worldwide for quality, support, and impact. Whether you're aiming higher or building tomorrow's talent, GSDC is your partner in purposeful growth and impactful leadership. Visit our website to explore our offerings. GSDC, share the best practices and learn from the best practices. Welcome
Hello, everyone. We'll be starting the session now. Please allow me to share my screen again with you all. I hope my screen is visible to you all. And thank you everyone for joining today's session. And I welcome you all to GSDC Certified Learning Implementing Generative AI in Healthcare with a theme that is Transform Patient Care and Clinical Workforce with AI Insights. So my name is Preetham. I'm going to be your host for this session. If you need any assistance during this session, you can reach out to the chat box and it will be taken care by me. I'm really excited to host this entire webinar series, which is scheduled from 6th October till 10th of October, and on tackling diagnostic challenges with generative AI in healthcare. And we do have amazing panel of speaker, healthcare expert who are aligned for this entire webinar series. So please do join us for all the sessions that we have. And today we'll be having Avnish Khare with us, and he'll be taking us through the topic that is generative AI in healthcare, opportunities, challenges, and the road ahead. So before he could start with this session, I would like to introduce our hosting organization, GSDC. We known as Global Skill Development Council. We are vendor agnostic, vendor neutral. We are globally recognized certification body. We are accredited by ANSI and ABICB. We do have 100 plus certification portfolio with us, and we have certified more than 250,000 professionals worldwide. We have 500 SMEs, those are subject matter expert, industry experts, affiliates from top universities like Harvard, Stanford, MIT. They work with us closely to design our deliverables, and we are associated with 1,000 multinational corporates and 500 Fortune companies and 30 plus universities across the globe. And I'm very proud to inform you all that we do have 100 plus authorized training partner across the globe. We have partner in Asia, Africa, Canada, America, and many other countries. So would love to thank you those who have joined us through our training partner channel. In case if you're looking for any training program for yourself, you can check the link I'll share in the chat box shortly. You can reach out to our training partner to inquire about the training programs that you're looking for. So, special thanks to our official media partner, World Press Hub, for covering all our events and press releases. As I mentioned earlier in my previous slide, that we do have 100 plus certification portfolio. So our current certification portfolio holds certification on emerging technologies, agile and DevOps, quality, compliance, learning development, digital transformation, and so on. So in case if you're looking for any of this certification in order to upskill yourself, you can definitely reach out to a learning advisor, or you can check our website, that is www.gsdcouncil.org, to get more information, more details, and check all the offerings that GSDC has for all of you. So what benefits you will be getting if you get certificate from GSDC? You will be GSDC's member for a lifelong, and with that you will be getting certificate upgrade. You'll be having free access to all our events, workshop, boot camps, and you'll be getting free access to all our exclusive learning program that we do have. With that, you'll be getting implementation resources, speaker invite, and newsletter. So all these benefits you'll be getting if you get a certification through GSDC. I'll share the link in the chat box shortly. You can check it out and do sign up yourself for this certification program. So without any further delay, I would like to tell more about Avnish. So Avnish holds degree in MBBS, MD, DNB, PDCC, MNAMS, MBA, is a physician educator and advisor at the intersection of AI and medicine, certified by American Board of AI in Medicine. He leads the Made AI Capsule newsletters, chairs the advisory board of the Doctors AI Education and Research Foundation, and serves as chief advisor to Indian College of AI in Medicine. He also coordinates the certificate course on AI in Medicine, contributes to BrainX AI USA, and has been recognized as a LinkedIn top voice, quoted in Forbes, and invited to the G20 India 2023 consultation at AIMS and Rishikesh. So, yes, we are very delighted to have you, Avnish, as a speaker today. Thank you very much for joining today's session. You can have the handover of the virtual speaker now. Thank you.
Uh, Thank you. Thank you, Preetham, and thank you, GSDC, for once again inviting me and providing me this opportunity to speak on a topic which is generative AI. So without wasting any more time, I'll just share my screen. And I can see a lot of familiar names in the participant list. So really nice to see all of you. And I hope you will be learning something new, at least even if a few things, because I know you have been learning about AI already. So with this, let me get started. Can you see my screen?
Yes.
Okay.
Yes, we can see it.
So my topic, when I was approached by GSDC and they asked me what topic would I like to speak on. So I chose this topic because it's very important now to understand about generative AI in healthcare. So world is now moving from the traditional AI towards generative AI, and a lot of applications are emerging. And we as medical professionals need to focus on this particular kind of AI, which is generative AI, and we have to see it from an entire spectrum, right from opportunities, challenges, and also we have to understand what is coming up, especially with the AI agents and also all this we will be covering in the next 30-40 minutes, and I'll be taking you through this journey with me. This is not going to be a conventional lecture on generative AI in healthcare, showing you what generative AI can do and cannot do, but it will be also giving you some kind of a roadmap. Uh, so if you are an administrator or if you are a clinician or if you are anyone working in healthcare, this webinar will be relevant to you. So this is something which I want to start with. And if you can see, and most of us travel on aeroplanes almost on a daily basis, many of us, and we hardly realize that it used to be one of the means unsafe forms of traveling when it was started. But now, after almost 100 years, medicine uh, has not reached that kind of a safe environment where aviation has reached. So I think we need to learn a lot. We need to have our own black box, like aeroplanes have their black box. So generative AI and the overall AI spectrum, in a sense, whatever AI can provide, I think that can act as our black box in medicine and healthcare. And of course, the black box in the aeroplane is, of course, many times it is not seen. It is in the working in the background, and only when we have some kind of a mishap, then it helps us to decode that. Similarly, AI can also be working in the background in all the hospitals and healthcare systems, and only when we need it to prevent any medical error, or we want to provide better patient outcomes, that is when it comes to the foreground and helps us do that, just like a black box does for aviation. So I just wanted to create an analogy. So from now on, if you think about AI or generative AI or any such emerging technology in healthcare, think of it like a mechanism which will help us build a safer kind of environment, and that is how it should be. So before we get ahead and I show you the agenda, I just want to ask you a question, and you have access to the chat box. So if you can just answer A, B, or C, like how familiar you are with generative AI, so that I know that what is the level of the audience that we are catering to. So I can see most of you are answering B and C, which is very good. So this lecture is not going to be about like only the basics. It's going to take you one step ahead, and it's going to give you a roadmap and a path of how AI should be implemented, and especially generative AI should be implemented into healthcare. So very good. So there almost B, C, C, and very few A. So I think you're in the right spot. So this is going to be like a snapshot. We are going to discuss under three headings. The first one is going to be opportunities. So this part, I think almost all of us on this call have a fair bit of idea about that. It is going to enhance care delivery. It is going to reduce administrative burden. It's going to improve the patient outcomes as a result of these two. So we are very much aware about this. But the second box is, which is very, very important, which is the risks. So I think there was a dialogue in a famous movie that with great power comes great responsibilities and also great risks. So these are the risks which come up with generative AI. And all these years we have been collecting data. We have been putting it into the electronic medical records, siloing it, and hoping that someday we will use it to maybe improve our operations or our healthcare. But what we have started realizing is that whatever we have collected, most of it is not of very good quality. It's full of biases. then there are regulatory compliances which are coming up. They are also evolving with time as generative AI develops. So that is another area which is a huge challenge and risk. Suppose regulatory uh, regulatory lags behind the development or evolution of technology, then there's a huge gap which is created between the two things, and that can cause a lot of harm sometimes. So that is another big risk, which is of course a clinical safety risk. And finally, what is unique to this lecture is going to be a roadmap. So if you are an administrator, if you are someone who is willing to work in generative AI in healthcare, or trying to start a company, or maybe trying to to build a tool, but how do you go about it? What are the keys to adoption? Like, why did you create such a nice tool, but it didn't get adopted? So uh, George, I don't know if I have pronounced it right, but what about illnesses and clinical patterns identification and recognition? Yes, I'll be talking briefly about it, but that is how it will enhance the patient outcomes and care delivery, right? By recognizing subtle patterns which our human eyes cannot recognize. So basically, AI and any AI, including generative AI, will help you see what our eyes can't. So that is definitely going to be there. Thank you for adding that comment. So I can read your chat, guys. So if you have any comments or anything to share or any question, please keep putting in the chat. We want to keep this an interactive session. There's nothing new in the topic, but then of course we are going to discuss and we are going to converse in a different kind of a way. So roadmap is going to tell you about the practical implementation, what should be the phases, how you should go about it, and how you should collaborate, and what are the collaborations that you need for a successful generative AI pilot in healthcare. This is going to be based on experience as well, because I consult and advise a lot of startups and a lot of health systems. So I can see what problem they are facing and why they are not getting the results. Sometimes it is in the control, sometimes it is out of control. So it depends. But then you have some kind of a, to give you a framework or kind of a thinking way, I will help you. So by the end of this lecture, you will understand that AI and generative AI are two different kind of things. Generative AI is not AI, and AI is not just generative AI. So that you will understand. Then you will also see, as mentioned in the comment, that yes, it helps improving clinical journey of the patient. It helps us provide better care as caregivers. It supports better patient engagement, and efficiency of care overall increases. And in the long term, this is going to reduce the cost of care, which is right now going out of the roof, because our healthcare is very good sometimes, but very costly. So if something is very costly, then it is not considered of good quality. So quality definition says that you should get a very good outcomes at lowest possible price. So that is what is the definition of quality. Then we'll see challenges and risk management. How do you manage all those challenges? That will sort of set you on the roadmap. And finally, I'll leave you with the roadmap which you can maybe try to implement in your next generative AI project in your hospital or your institute. And we'll end with the future outlook. So let's move to the first section, which is very important to understand. Many times people tell me that I am learning about AI, and when I inquired them that what are you learning, they tell me I'm learning how to use ChatGPT, how to use Gemini, and how to use Claude. So just to clarify to the audience here, I know all of you, most of you are learned in AI, and all are learned professionals, and you understand that generative AI is not the entire AI, but I want to bring your focus to the traditional AI, which was there before 2022, November, when ChatGPT was launched. We had something called traditional AI. It was not called traditional AI that time, it was the only AI. But that was very good at two things. It was good at predicting something, and it was good at classifying something. Yes, deterministic AI. So that was the talk of the town. And when I started learning about AI 6-7 years back, that is when we didn't have something called generative AI, and this was AI. If you wanted to predict some kind of a numerical value based on past numerical values, just like finding patterns, or you wanted to maybe classify or diagnose patients, or classify people into different classes, like maybe diabetes type 1, diabetes type 2. Similarly, you might have different phenotypes of different diseases. That is when you wanted prediction algorithms. And these used to provide definitive answers. Uh, if you operate the AI model 10 times, 10 times it will give you the same answer. It will not be different. There was a layer of repeatability in that kind of AI. But now, with the advent of ChatGPT, Gemini, and all these generative AI, large language models, and even now we have large vision models, and many new developments are happening. So basically, after the transformers kicked in, that is when we started hearing about something called generative AI, because now this generative AI is creating new content. The traditional AI which we were talking before was not creating new content. It was ingesting the data, it was ingesting whatever you were giving it, it was finding patterns, and then it was either predicting it or it was classifying it. But now with generative AI coming in, it is creating new content based on the content you provided, or based on the content that it is trained on. So this is also ingesting a lot of data, a lot of content goes into training this kind of AI. But then it goes one step ahead and starts creating new content based on patterns learned in that data. This is something which is very new, and also it is very sensitive to context. So if I don't give the complete data to generative AI, if I don't give it the complete context, for example, if I'm using ChatGPT and I'm taking opinion about a patient who is having fever, and I just tell the ChatGPT that the patient is having fever. I don't tell it anything else. I don't tell the age. I don't tell the gender. I don't tell the background. I don't tell the history. I don't tell the lifestyle the person is following. Then ChatGPT will give me some kind of answer, but it will not be very accurate, because it is not getting the complete context. And that is where the art of prompt engineering has come. And now it is being called context engineering. And we had a very good webinar a few days back on GSDC on context engineering, and I also attended it. And it was very insightful that now we are moving from prompt to context. So I hope with this diagram now the difference or distinction is clear. And next time when you talk about AI, you will be able to tell whether you are talking about traditional AI or you are talking about generative AI, because both two things are very different. The world nowadays is focused more on generative AI, and that is what we will be talking about moving forward. And that is why this webinar series says generative AI. So because generative AI is right now the thing that everyone is focusing on. So this is how generative AI basically works, especially in healthcare. So nowadays the language models have become multimodal. By multimodal, I mean initially they used to take only text as input, but nowadays you can even give images. So you can give an ECG tracing, you can give X-ray, you can give the patient history, patient notes. And then what the model does, it processes and synthesizes the patterns, as George said in the chat. It processes, it synthesizes the patterns, it matches them to its learning, which it has done in the background from large data. It kinds of matches it, and then it creates an output. So this output part is something which is generative. It is generating some kind of new text or new image or new video. So now even input is multimodal, and even output has become multimodal with the developments happening in transformer technology. The problem is, as I told you, with the deterministic AI or traditional AI, if you run this model 10 times, output will be same. But with generative AI, if I run this model 10 times, 10 times output will be different. And it might sometimes be very good, it sometimes might be very bad, and it is very difficult for anyone except a human who is expert in that field to validate it. And that is where this fourth step comes in of generative AI, which will be very important. And I will tell you when I give you the roadmap that why validation is important for adoption especially, and why will generative AI not be adopted in healthcare unless it is validated by humans. And if you want to validate at scale, now we have something called as large language model as a judge technology, which is coming up. So they are getting humans to validate the output, and then they are coding it into some kind of a large language model, the rules, and then that large language model is then acting as a judge for the other outputs. So this is what is happening, and this will be very important in healthcare. So that is why I wanted to focus and put this slide for you. So let's see why generative AI. I told you generative AI is being talked about mostly, and why it is being talked about, I will be telling you now. Why not the traditional AI, and why we have shifted focus? Because first thing which is very exciting is multimodal integration. So the old models which were there, they used to take only one modality of input, either text, either image, or either any kind of a table. But now with generative AI coming in, we have unlocked the power of multimodal integration. So you can input any kind of text, you can input image, you can input time series data. So any kind of unstructured data you put into the model, you just throw it in. You are now able to utilize your data lakes. If people from IT background are on this call, so they will understand that data lake is somewhere where you just dump all your data. It is a mix of data. There are images, there are audio, there is video, there is everything that goes into it. It is not structured at all. So till now, we didn't have any kind of a technology which would ingest it as it is and then give us some meaningful output. So generative models have showed that ability. Of course, they are not perfect. They are improving and they are getting validated as they evolve. But this is a very big advantage because healthcare data is multimodal. Whenever a doctor sees a patient, they don't just talk to the patient, they see their x-ray, they see a lot of investigations, they talk to the patient, they hear their voice. So it's kind of a multimodal environment. So that is why large language models and generative models matter in healthcare, and why we are talking about generative AI. Second, advanced language understanding. So as you know, if some of you are medical professionals on this call, so you will understand that there's a lot of medical jargon in healthcare, and healthcare language is very different. Many times my relatives send me reports, and when I explain to them, sometimes I explain them in the medical language, they don't understand. They need me to simplify it, to contextualize it to them, and then they will be able to understand it. So this kind of ability is also there in large language models or generative AI. So it can help in superior documentation. It can help in summarization to the level of the patient at which the patient understands. And this saves physicians a lot of daily time. There are studies out there now, a lot of studies are coming up, and this is the usual range, which is 30 to 40%. Again, it is debatable because some people will say that the methods of data collection are flawed and the criteria are all wrong. Sometimes in studies, they are done in a controlled environment, they are not done in the real world. So those things are there, but then definitely there is some kind of reduction in effort and potential saving of time. So that is there. So that is another attraction which is leading us to push towards generative AI. Then customization and adaptability. So initially when ChatGPT came out, people were asking it some factual questions and they were not getting good answers. There were a lot of hallucinations, and many people even put on social media some screenshots, and there was a lot of social media memes happening, and even company stock prices were going down because of this single kind of wrong activity of the large language model. So that is when they found out that if you add something called as RAG, or retrieval augmented generation, where if you can give some kind of context, this is again part of context. So if you give some kind of maybe guidelines, or maybe some kind of text, or maybe a textbook, if you feed into the back end of the LLM, then the LLM suddenly becomes quite knowledgeable on that content, and it starts giving you answers from there. So, and that is how models like Perplexity were born. So they combined search of Google with the kind of RAG kind of thing in the background, where you could verify from where this information has come, and this ability to verify the source from where the large language model has taken the input is very good for healthcare, because in healthcare you have to cite everything, you have to explain everything, you have to tell from where you took this thing. So this is very good ability which is now coming in generative AI, and this is getting people attracted. So advanced language refers to natural language or language models. Yes, Arup, advanced language means even to the normal linguistics, like our linguistics, like the initial models of ChatGPT, GPT-1, GPT-2, they were not having very advanced language understanding. They used to give very prose kind of a language, which was very like machine-like. But that has now changed to advanced language understanding. This is what I meant by advanced here. And finally, the cost is going down because the use is increasing, and we have figured out the technology. We have figured out how to get ROI from it, uh, uh, not in healthcare, but in other industries for sure. So a lot of cost is going down, and there's something which is coming up, which is called edge computing. So it is also making things easier. So now you can run a small language model on your own device, and you don't need a cloud or a big kind of infrastructure for it. So those barriers are being removed. So these are the kind of things which are happening, and that is why generative AI is being talked about. A lot of ROI, and healthcare organizations are now also getting interested into this and trying to do pilots. Now, this is the opportunity roadmap, opportunity map kind of a sense. So you can see there are two axes. On the x-axis, there is operational effort, which is needed to achieve that activity in a clinical environment, and the clinical value on the y-axis. So there are four quadrants. So you can see that this documentation, care plans, and all those content creation activity in healthcare, which happens, is kind of high operational effort. It takes a lot of effort to write a note for every patient in the ICU, 20 beds, customizing it to them, changing the medications, doing all those things. It takes a lot of effort, but it has high clinical value. If you don't do it, then that is what is the patient is coming for in healthcare, right? So yeah, just seeing the chat. So that is something which falls in high clinical value, high operational effort, and this is one of the areas which is being affected first by generative AI, because this is high in clinical value and high operational effort, more chances of ROI. So you can see a lot of AI scribes coming in, which are helping in documentation. Then second area which is there is high operational effort but low clinical value, which is workflow automation, and this is where AI agents are coming in now. It lot of pilots, lot of experimentation, because this is low clinical value, so it is going on in the background in the administrative parts of the hospital. So this is one another area where a lot of opportunity is coming in. Then uh, something this I will leave for the last, the low operational effort and low clinical value. This is not so much important, but then again, translation. Sometimes in to translate it to the patient language, or to translate something between the various stakeholders. So that is some kind of an activity which is again very much needed in healthcare, because there are multiple stakeholders. But this is something which is high clinical value and low operational effort, which is sense making. So a lot of clinical decision support algorithms which are now coming in, they are coming in this area, and they're trying to exploit this opportunity because there are a lot of fixed algorithms, there are a lot of fixed guidelines, there are a lot of fixed kind of uh, literature evidence which we follow when we are doing sense making in healthcare, and also a lot of data which we are kind of seeing at. We are seeing at some fixed lab values. We are seeing at combination of lab values. So all those things, they have high clinical value, but when done by machine or AI, they can definitely reduce that kind of an extra burden for humans, and maybe give out the filtered insight. So that is another area where a lot of people are looking at opportunities in generative AI. So I hope now the opportunities are clear to you. And whenever you think about generative AI in healthcare, whether as a developer, whether as a user, so you can now understand that how the landscape is being shaped. So of course, I would like to emphasize that AI will always augment the decisions. And human oversight is essential, especially in generative AI, because I told you it's a probabilistic technology. It's not a deterministic technology. It will give you different answer 10 times. If you use the same prompt, the answer will be different. But this is where validation comes in, and we'll talk about that. So a bit more on personalized treatment and decision support, which I was just mentioning in the previous slide. These are the clinical applications which people are looking at, and we could do an entire webinar on this. Personalized care plans, therapy options, drug interaction flagging, dosing, differential diagnosis, brainstorming. All these are clinical applications. There are a lot of tools out there which are doing this. And even if you don't have a tool, you can do this in normally available tools like ChatGPT. But of course, you have to be an expert to be able to understand the risk, do it responsibly, and of course, identify the hallucinations. And these are the measurable outcomes which people are looking at in healthcare, which is faster decisions. Sometimes decisions happen when either patient is gone or maybe the disease has progressed so much that now the decision doesn't even matter, especially in things like cancer and all. So if you have a faster decision and protocol adherence, so that is going to be a measurable outcome. Reduced diagnosis time, improved pathway adherence, adverse event prevention. A lot of cost goes into managing the adverse events. So all those things. Patient journey configuration. Yeah, George. So basically customizing, personalizing, individualizing, removing bottlenecks, all those kind of things you can think about. These are the application areas and opportunities of generative AI. There are a lot of bottlenecks in healthcare. Having worked as a clinician for 10 years, let me tell you that the moment you step inside the hospital in the morning and the moment you come out in the evening, you will see 100 bottlenecks. You just have to work with a clinician, shadow a clinician for some time, and you will understand what I'm saying. The only thing is clinicians don't have time to sit down and note those things and then tell to the team and then do all those things. So sometimes very busy workflows. So you have to understand this. And that is how you bring AI into healthcare with contextualization. And that is only when your tool is going to be adopted, or that is only when the doctor is going to use your tool, when it doesn't hamper their workflow. Okay, so it has to be high clinician satisfaction and reduce treatment variation. All those things are also important. So this is the opportunities. So I would like to just end here the opportunities part, and let's move to the challenges next. There are a lot of real world impact, generative AI stories. You can go and you can check on PubMed, and a lot of research now happening. Even NAGM AI is a good journal where there are a lot of evidence is coming up about generative AI. We are doing a systematic review on use of generative AI for medical education. So that is another area where AI is making a lot of impact, especially generative AI. So you can see Mayo Clinic, Stanford Healthcare, Kaiser Permanente. These are all big groups, and they are achieving this kind of results. They are reporting, they are presenting in international platforms. They are coming up with papers. So this is something which is already happening. It's not imaginary, okay? So Samir, I'll answer your question in the end. Yeah. It's complicated. So I'll just tell you. Generative AI improves efficiency, clinical well-being, and patient care. This is the usual observation out there right now. Of course, it's evolving. We need more studies. We need more research. We need more cost efficiency studies, risk-benefit analysis. All those things need to happen. This is a very new technology. Please don't forget, this is only hardly a few years old, and already it is being applied into many fields. So still it is not properly researched. So that has to come in. Of course, some recent research and evidence is coming up in these journals, but a lot of work has to be done, and we all have to contribute towards it. So now my second question to all of you, so just to check so that you all are not sleeping, that which of these benefits matters the most to you, whether you are a clinician, whether you are an administrator or leader or nurse or anyone in the system, or even a patient. So what are these, which of these benefits matters the most to you? You can answer in the chat box, A, B, C, or D. So you can say all also. That's good. Shows presence of mind. But now everyone is writing all. So yeah, D and C. So C is one of the big choices. I can see many people are saying all. All is an easy way out. Then D, patient satisfaction. So most people are tilting towards this better decision and patient satisfaction in this audience, which is good to see. Better decisions, of course, will lead to patient satisfaction and will again lead to reduced burnout, because if you make better decisions, you improve the efficiency of the care, you improve the quality. So C is definitely a big, and if I would have chosen, I would have maybe chosen C as well, because it's related to all the other three. So thank you so much for participating. I can see some nice comments in the chat. So it's very nice to see people interacting, and thank you so much. Now let's see what are the challenges. We saw the opportunities. So first part of my talk, which is I told you about generative AI. I will talk about opportunities. I will talk about challenges and risks, and then we will talk about road ahead. So this is the second part. So navigating implementation challenges. So many of you must have seen that there are wonderful projects which are started with huge hype in health and huge newspaper, but they fail to make any impact. And maybe after a few months, no one is even talking about them. So these are the 4 critical areas which people have identified. So just to bring to your notice, data quality and bias. This is what I told you in the beginning as well. We have collected a lot of data and we think that we have a lot of data which we can harvest and we can use. But when we actually look at the data, we understand that it is full of missing values, full of historical biases, and even the data itself needs validation and generalization because it's too much siloed. So that is a big implementation challenge, especially with generative AI, because generative AI needs a lot of data. The traditional AI used to have some kind of data capping based on the model which you are using. So I'm trying to simplify it so that I know many people are non-technical on this call as well. So depends on the type of model and the type of problem that you're solving, you needed certain amount of data. But with generative AI, it's like the stomach size of generative AI is like very big. So that is why it's called large language models. So you need very large amount of good quality data. So both things at the same time, large amount and good quality, this is very difficult to achieve, and especially in healthcare. So we have to find out a way around this challenge. Second is privacy and security. You must have seen a lot of media news and headlines around people's data getting leaked through tools, these generative AI tools, because it's all about intelligent prompting, right? If someone can intelligently prompt, there's something called as prompt injection, where if you inject that prompt and the model will spit out everything which it has learned. So even if it is a confidential data, so it will be in the public domain. And in healthcare, it is a very big risk or challenge, because anyone implementing generative AI, any big health system, they don't want to land on the wrong side of the legal table. So that is why another big challenge is there. There has to be protection around PHI. PHI means protected health information, which is like patient's personal data, name, phone number, and all those things. You have to deploy it securely, which again becomes a challenge in limited resource settings. And you need to have comprehensive policies, which almost all all medical professionals on this call will agree that we are very slow in making policies, especially around technology. Explainability and trust. Again, as I told you, this is a probabilistic technology. So an interesting discussion going on in the chat about health, medical education, and AI education for doctors. I'm feeling quite tempted to enter it, but I'll resist my temptation and I'll keep on track. Explainability and trust is very important because this is a probabilistic technology. I told you 10 times it gives 10 different answers. So there has to be some kind of explainability why this answer was achieved. And now with reasoning models, some kind of explainability is being built in, where it helps you to understand what it is doing actually, what the model is doing right now. So that is very important in healthcare for adoption. And finally, regulatory compliance. So all the medical professionals out there have to get licensed. They have to operate under license. They have to protect their license. And if you're telling them to use a generative AI tool which is not regulatory compliant, and if they make any mistake due to it, then they're going to lose their license, or even the healthcare facility is going to lose the license. So that's not going to be how it is going to be applied in healthcare like it was applied in other areas. Healthcare is going to be a bit different. So these are the challenges, 4 key challenges. I know many of you have already idea about this, and I might not be telling anything new, but just I'm trying to tell you a story and to put it into perspective and help you think in a structured way. So that is my purpose as an educator. So what I want to emphasize is that early investment in robust governance frameworks leads to faster adoption and value. Don't think about all these things down the line. Once you have bought an AI tool, then you are thinking about regulatory compliance. No use, useless. So even before you get started on your project, or even assessing the AI technology out there, you have to think about these things, especially in healthcare. So as I already covered this, these are the core challenges in data quality. and these are some mitigation strategies, of course, not perfect. And there has to be continuous monitoring and continuous improvement of data pipelines to prevent further like compounding effect of. So there's something called compounding where small kind of error if created uh, upstream, it leads to a lot of errors being created downstream. So that kind of thing has to be prevented, because if once this vicious cycle starts in data and data starts getting corrupted, then suppose a doctor is just doing copy paste of the previous patient notes. I'm not saying it is done, but suppose if they start doing it every day on the round, then that will lead to a compounding effect and it will pollute the entire data pipeline. So we have to understand how we can prevent it. So continuous monitoring and multi-site validation, of course, is another way. And bias audits have to be done. There has to be a complete policy around it. As I told, policy making is very poor in healthcare, especially around technology. Then this also we covered. PHI protection, purpose limitation means you have a clear policy written where you will use AI and where you will not use generative AI. How much data will be put into generative AI, what kind of data will be put in, what kind of data will be held out, all those things, and what amount of human oversight, human review will be acceptable, and when will we escalate the thing to a human. Now, especially with chatbots coming in into healthcare, it's sometimes very frustrating. You want to talk to a human and the chatbot is keeping you in the loop, going round, and you understand that your problem is not getting solved. But sometimes it happens in these common AI tools also that the task you are asking them to do, they will not do the task, but they will keep rotating around that task, but not doing it. So that kind of thing is important. You need to have human oversight because time is critical in healthcare. Suppose something bad happens, then the patient suffers. So these all are the ways how you can help in privacy. Uh, Explainability and trust, always source attribution. So I always prefer Perplexity over other tools. Um, this is not an endorsement, but because it used to do source attribution, it used to tell me from where it is taking that kind of data, from where it is taking the information which it is providing me. So I had more trust. Similarly, if you are building an AI tool or if you are getting an AI tool for yourself or your patients, so you need to have this kind of functionality built in. There has to be reasoning transparency. It should be able to reason with you. It should be able to explain the choices, not just give you a answer that, okay, do this. That is not the way how healthcare works. And it should also tell you how much confident the AI is. Like, as I told you, it's a probabilistic technology. So generative AI should be able to tell you that, okay, I'm this much percent confident that this is what is the right thing to do. So that is what is needed, because that will help clinicians make faster, better decisions, and also it will help in adoption. AI adoption is ultimately the key, what we are talking about and why we are having this webinar. All medical education and AI education, everything leads to adoption and better patient outcomes. So that is ultimately our goal. Regulatory and compliance navigation, again, you have to be aware about FDA requirements. You have to be aware about how to prepare the regulatory documents, how to validate it, clinical validation. So I told you human validation is a very important factor in adoption of generative AI, especially. So you need to know the various frameworks, how they are used, how to validate an AI technology in your setup. All those things you have to know, even if you are a developer or you are a clinician who is using AI. Post-market surveillance is very important, and you have to follow all the interoperability standards. So these are the challenges also, which I mentioned in the last few slides about generative AI, and these are also the risks, and these are also providing some kind of a solution to those things. But more clarity will come in the roadmap. Okay. So again, emphasizing critical to engage everything early. Don't wait for the last time. Don't wait for the deployment stage to figure out that you needed a legal expert in your generative AI for healthcare. Everything should be done from the beginning. So this is just to sensitize. So now I want to ask you one more question. What worries you most about generative AI in healthcare? I know you all are aware about all these four, but what keeps you awake at night, if I ask you, especially in context to healthcare? So is it data privacy issues? Is it legal risk? Is it accuracy hallucinations? Is it biased outputs? So what do you guys say? So again, I see there's a bias for C. Okay, C and D. Okay. So not many people are worried about data privacy issues and legal regulatory risk. So which is a bit concerning for me. But then okay, C and D are more important in healthcare. I can understand because healthcare is all about correct information at right time and equity of care to everyone. So we cannot do with C and D. B, of course, is catching up. Regulatory, FDA, and all those bodies are catching up with this B. And data privacy issues. If we anonymize the data properly, we keep it secure, although there are a lot of caveats around it and a lot of hacks are still happening in healthcare. So this is, with generative AI, it becomes even more complex. So I would have loved to see A a bit also. So, okay. So people have listened to me and they have started putting A. Thank you so much for participating and showing me that you're awake. So finally, in the end, let me, for the last 10 minutes or 15 minutes, take you finally to the roadmap and try to stitch it all together. And let us see how it is to be done. Whether from a clinician's angle, whether from a developer's angle, whether what a patient should be looking when they are told that AI is being used for your care or you are a part of a generative AI pilot. So all these things are very important. So you have to have a vision, and then you have to also see that it delivers value. So when I consult a lot of startups, they have wonderful visions. But is it valuable? Uh, this question, sometimes I have to ask a very hard question, and sometimes I get a reply, sometimes I don't. So value is very important, and you have to scale the pilots to value. Okay, so always it starts as a small thing. Don't try to go very big in the beginning, because if it is not valuable, then whether it's a wonderful idea, it's a very good vision, it's well funded, everything is good, but if it's not giving enough value, it's useless, especially in healthcare. And healthcare is very much, I would say, like a ruthless is the correct word for value. Very difficult to sustain cost wise if you're not giving value. And even in the adoption stage, you will be left out, because clinicians and whoever your end customer is or end user is, if they don't find value in your product or in your set, in your thing, it will not get adopted. No matter how AI literate the physician is, it doesn't matter. So you have to discover use cases. You have to, as I told you, shadow some clinicians. Go work with them if you are a product expert, if you are a technologist. If you're a doctor, try to, again, you also discover where the technology is going. Try to learn about it. See how you can identify some use cases in your already existing bottlenecks. I told you, we clinicians see 100 bottlenecks in a day. So maybe choose one. But for that, you have to understand that, okay, which is the best one to choose. To narrow down, you have to understand the technology. Then you start with a pilot and you iterate rapidly. This is what you have to do. You have to validate it with experts in the proper real time settings, not in controlled environments. You have to pass this stage 3. If you don't pass this stage 3, then your thing doesn't cross the pilot stage. I have seen some companies who say that now we have scaled up, we did a small pilot, and when I ask, did you do the validation? So no, what is validation? So this is very important step which you have to do, especially in generative AI, because there is no other way to validate it at present, because every time it gives a different answer. So you need to validate it whether it works or not, and that is how many medicines also in healthcare are used. Many of the medicines we don't understand how they work. Like there are hypotheses that okay, this medicine works like this. Maybe there is some receptor somewhere, but we don't know exactly. But why we use it freely, why we are able to prescribe it with confidence, because it has been validated, it has been tested, it has been checked multiple times, it has been monitored post market surveillance has been done. So that is what brings confidence. So that is very important. And once you have validated it, that is when you scale it. and you train your users, which we are talking about in the chat, user education. So Samir asks me, do you suggest clinical validation to be done externally by experts? So it has to be done by experts, which has to be done in the real environment. If it is a clinic environment, it has to be done in a clinic environment. If it is specific to a geography, you have to go to the geography and validate it there. If you are building a tool for India, you have to validate it in India. You have to validate it on Indian data sets. All those things are very important. Just validating it in a lab somewhere with hypothetical patient scenarios or some virtual patients is not going to do. Yes. And finally, you have to maintain it, operate it, which is something which is the last stage, which is also important. If you scale it and then you leave it as it is, it's not going to survive. This technology is a very fast evolving technology, changing very fast. Even healthcare itself is evolving, it's changing a lot. So two things changing in tandem creates an environment where you need continuous monitoring and updation. So that is another thing which I want to highlight. So as I told you, divide your journey into these 4-5 steps. This will ensure safety, efficacy, and readiness. Even if you are a clinician, try to ask the company trying to sell you the GenAI tool, which stage you are in. Are you in a pilot stage? Have you validated it? Are you scaling it? Are you already deployed and you're operating? So all these things. This slide is a multi-purpose slide. It's not for a specific audience. I know there's a mixed audience, and I wanted to keep it a mixed kind of a context. Okay. So this go from pilot to scale readiness. So this is how you choose one single case. So always you might want to solve all the problems in healthcare. There were some companies which came in healthcare which wanted to solve all the problems in healthcare, and they just closed down. No one talks about them now. They were a big talk of the town in those times. So you have to have a single defined use case. As I told you, out of 100 bottlenecks, you have to choose one. Then you have to define metrics. How will I measure success? Okay, if I am applying a generative AI tool to solve this problem as a clinician in healthcare, what will be my success metric and what will be my safety boundaries? These all have to be defined, especially in pilot. When you're doing a pilot, these have to be very clearly defined, and otherwise you won't be able to validate the value. Okay. And shadow limited release is another thing. Just like you let the AI to work, but you don't act on the output. So that is something called shadow release. That is also some kind of validation which happens, step of validation. Then you have to have SOPs and clear override mechanism. You should always be able to pull out the plugin generative AI, especially. It should not be that the node gets auto signed by the system and the clinician doesn't know. So all those things are red flags. This should not happen. You should be able to stop it there. So always try to build those in your tools. And when you are a clinician looking for generative AI tools, look for tools which have that override mechanism. Okay. And these are some of the some of the checklists you can use. You can take a screenshot. So these are some kind of metrics. Like if you are investing in a stock market, you need some kind of metrics that validate your observation. Of course, nothing is sure, but then you become more confident if these things are met. So this is something like that. Okay. And finally, you need to understand that healthcare is multi-stakeholder environment, and it will need multidisciplinary collaboration for generative AI to succeed. It will not be like I am a vendor of generative AI and I sell it to a hospital and a clinician uses it and patient gets the benefit. It's not so simple. You need to have all these kind of players in your team to be successful. You need to have clinical champions who are, of course, clinicians who understand technology. And this is where the skilling part comes in, training part comes in, which was being talked about in the chat. Because they should be able to define use cases, validate workflows, and drive adoption. This is the most important player in your team in healthcare generative AI. Second, data and ML engineers, then IT security teams, as I told you, to develop kind of a privacy environment around it, privacy and security environment around it. Legal and compliance players have to be there. Then those who understand FDA policies, those who understand the evolving changes happening in the compliance arena, you need to have those. And finally, also you need patient voice. you are building a Gen AI tool which is going to be ultimately used to benefit the patient or to affect their journey in the hospital. And if they don't have a voice, then what is the use? You might fail at the last step. So patient representatives are also important to provide insights, clarity, and improve usability of your Gen AI tools. So finally, let me end with the last two slides. Future outlook, next 5-10 years, no one can predict. Uh, you will say that we are already living in future, and it's very difficult to predict the next 5-10 years. And the next 2 years is difficult to predict 5-10 years long journey. But these are some of the things which are happening. So now we are moving towards standards and we are moving towards AI scribes. So I think this journey is going to be completed by 2026, where we'll have a foundation and a lot of work will be being done by AI scribes. We'll be using them routinely, not just for hobby purpose or for studying for research. It will be like a foundation. And then this multimodal integration, which has started right now, will improve and even enter into healthcare. So we'll be able to integrate multimodal data, all healthcare data becoming digital gradually. So that will happen in next few years. And then once this happens, then we will be able to get better predictions. Yeah, George, it looks like an eternity, but believe me, even the next 1 year looks like eternity right now with the way things are moving. But I had to provide some kind of a number. So I thought this is a fairly safe number because anything can happen. See, this slide, please don't take it on my word. This is something which is my opinion, but your opinion might be different and reality might be totally different. We don't know what will happen tomorrow. So predictive convergence is going to happen as more and more multimodality gets incorporated. Then this is going to lead to research acceleration nowadays also we are seeing, but the research which is being accelerated right now is not very high quality. Mostly it's review articles which people are using AI to generate review articles, filling the medical research arena with garbage many times. But the true research acceleration, because of synthetic trials and all those kind of things that are going to happen after we achieve this kind of foundations, and then personalization at scale, which was being talked about. This was a comment in the chat some time back, and this is where we want to reach, have to reach in healthcare. This has been long overdue. We have been treating with one size fits all. Now we have the data, we have the technology, we have the resources, money or not, I'm not sure, but gradually we have to figure it out how to do it, and this is going to come up. And then only we'll be able to achieve this dream of equitable healthcare, prioritizing health equity, affordability. These all fancy terms which you talk about in all the conferences about sustainable goals. This is only going to happen once we go down this path. Okay. So of course, this is not the only track. We might derail also. That is another risk. So that is why we discuss about the challenges and risks in detail. That was the purpose of talking about that. So now last question, when do you think AI will become a routine clinical assistant? It already is in 3 to 5 years, in 10 plus years, and never. What do you feel? Just mention A, B, C, D. So 3 to 5 years, 3 to 5 years. Yeah, Ahmed. Dr. Ahmed has said that 5 to 10 years outlook is actually reasonable for the ongoing. But yeah, we will have a lot of glitches. We'll have a lot of failures. It's not going to be linear. People many times uh, predict future in a linear fashion, where in fact it is algorithmic or there are many glitches. Stock market doesn't go up in a straight line. It goes up, comes down, goes up, comes down. Ultimately, it goes up in the long run. So I completely agree with your point, and that is why I kept this. Also depends on countries. Yes, Samir, I agree with you. I am talking globally right now because I'm talking to a global audience. So I'm not geography specific as of now. Yeah. Okay. So most people have answered it already is or in 3 to 5 years. So that is the timeline where they are looking. No one is answering COD. So finally, I wanted to participate in this talk which was happening in the chat. So I put this slide because I knew that this talk will come up in all the talks. This educating physicians, AI literacy. This is a very big theme which is there, right? And these are some of the essential skills for clinical teams which are coming up, especially with the advent of generative AI, because now you are able to talk to AI, you're able to communicate with AI, use AI, handle AI, which was not possible before. It was part of research labs, but now it is in your mobile phone. So you need to learn these skills. I'll just give you a list. Prompting for accurate AI queries. We had a very good series on prompting with GSDC some time back, and we did context prompting. All those kind of advanced prompting was done. So this, you have to learn as much as you can and practice as much as you can. Don't leave any webinar, any series, anything related to prompting at present, because you will own, even if you gain 1 or 2 points out of any webinar on prompting, it will help you improving your art. Then evaluation of AI outputs. You have to understand how to validate, how to evaluate, how to check those tools before adopting. You have to recognize the limits and challenges of AI. Everything is not rosy. I see many people who become too optimistic about AI, too optimistic about generative AI. They say from tomorrow healthcare is going to change. No, it's not how it happens. AI, any technology has its own limits, and you have to be educated to understand that. Then workflows. You have to understand where AI will fit into the workflow. It doesn't fit everywhere. You don't kill a mosquito with a nuclear bomb. Okay, just remember this line. You don't kill a mosquito with a nuclear bomb. Where you don't need AI, don't use AI. Why you want to use AI for everything? So that is another thing that we need to understand as clinicians. And finally, continuous learning. This is not some kind of a degree like we did, like Pritam mentioned my degrees before the talk. I did those and I finished those, but my learning in AI started and it's continuing and it will go on for my lifetime. This is how I see it, and it should be the same for all of you. So you keep looking for these modules, hands-on trainings, mentorships, courses, whichever are coming up on platforms like GSDC and many other platforms out there. They are building wonderful courses and offerings for all of you. So keep on the lookout, and whatever you can do as per your capabilities and time availability, you should do that. Keep doing it. And thank you for joining today also, because this is part of your commitment which you are showing to develop skills. So final key takeaways: friction reduction is going to lead to AI, Gen AI adoption in healthcare. If it is friction, it is not going to be adopted. It should reduce burden. It should provide real value. It should be safety first. You have to start small, validate, scale if safely. Don't come to doctors if you are an AI technologist with very fancy tools on a large scale. It's not going to be adopted. Be transparent, build some kind of transparency. I know it's difficult in generative AI. Explainability is very difficult in generative AI, but there has to be some way to figure it out. Otherwise, adoption will not happen of generative AI. We'll keep talking about it in webinars. Collaboration is needed. I told you what are the different stakeholders. So start looking for them in your team now, building a team. Even if you're a clinician, build a team with technologists. And then always be outcome driven. You should always focus on clinical operational impact and not just the fancy technology of generative AI. So that is my ending message to all of you. Be responsible and develop responsible AI and use generative AI responsibly in healthcare by ensuring these 3 pillars, which is governance, training, and validation. Without this, no generative AI in healthcare. So thank you so much. Thank you for listening, and you can connect with me. You can reach out to GSDC if you want to reach out to me, and I'm also available on LinkedIn. So with it, I hand it over back to Pritam. Thank you.
Wonderful. Thank you very much, Avnish, for such an insightful session. Thank you so much for your contribution to us, and would love to inform all the participants this healthcare session is being conducted right now. A huge contribution and credit goes to Avnish, because of course he came up with this brilliant idea to GSDC. Thank you
Yeah,
so much,
yeah.
Avnish.
So one point I forgot to mention the credit to GSDC team as well, because they helped me in preparing this presentation, because I was short on time, and I requested them to help me, and they came out with at least a basic skeleton which I was able to modify and improve. So thank you to GSDC team as well. Thank you.
Wonderful. Thank you so much, Avnish. I believe that you have already addressed all the questions that we have got during the session, right? So we'll be taking two questions that I've got across live platform, and after that we'll proceed with the closing. And
Mm.
before that, I would like to inform all the participants. I do have such great announcement for all of you regarding the certification. So stay connected till the end, right? I'll be giving you some discount code offer, right? So please stay connected. So Avnish, I've got this question across live. Michael is asking, which regulatory or compliance hurdles should institutions anticipate when implementing generative AI in patient care?
Yes. So uh, the person who has asked this question, if they are working in healthcare, they will understand that anything we apply in healthcare, right from any medicine or any device or any kind of technology, it has to undergo a health technology assessment kind of exercise, where you assess all the risks which are associated with the technology and how you will mitigate those risks. And there are a lot of frameworks available out there. And even for generative AI now, a lot of research is happening and many good frameworks are coming out. And I'm sure many organizations like WHO and FDA, and even in your particular country, for example, in India, it is ICMR. So all these bodies are coming up with the frameworks to help you identify those risks. Those risks will fall along the lines of whatever we discussed today, risks and challenges. They will definitely fall along those lines, and you have to anticipate them, as I told you beforehand. And how you will do it, these frameworks will help you, and thinking in a structured way before even getting started on a pilot project. Or even if you're not building the tool yourself, if someone approaches you, a vendor approaches you with the tool, you ask them those correct questions, which I told you. Of course, this is not comprehensive, which I told you in this webinar. I can tell you only this much in 1 hour. There's a lot more to it. There can be an entire workshop on it, but definitely you should have some kind of framework and some kind of structured thinking. And you should always question the technology which is being applied, to avoid hitches down the line.
Wonderful. Thank
I
you so much, Avnish.
hope
Yeah,
that answers.
absolutely.
Yeah.
Absolutely, absolutely. I can see another question that we have got on chat. Musa is asking, how can generative AI will continue to revolutionize the clinical trials in healthcare, especially in electronic health record (EHR) in healthcare organization?
Yes. So a lot of companies are working on this, Musa. I'll not take any names, but what happened initially in electronic medical records was that data was there, but to get it, uh, fetch it, uh, and to maybe output it in a way that can be useful or helpful, which can save time, was not available before generative AI. It was very difficult. But now, with the advent of generative AI and these large language models, and with multimodality creeping in, now it's very easy to query a EHR. uh, Now even some EHRs like Epic and all, they are coming up with their own modules around AI, which are custom built by them on their own tool, which work very nicely. And you can very fast, you can query any kind of data, and this applies to clinical trial as well. If you are searching patients for clinical trial based on certain criteria, you can just put in the criteria in the prompt, and it will fetch out all the patients and all the insights and all the details from the entire, as I told you, the data lake of EHR. It will pull it out, and it will save time, it will improve efficiency, it will reduce cost of clinical trials. So this is definitely going to help in clinical trials. Generative AI has a huge role to play in EHR data.
Wonderful.
Yeah,
Thank you very much, Avnish. Moving forward to the next question, we'll be taking this question as a last question. So
yeah,
I will request participants, if you have any further question in your mind regarding this today's session, please feel free to reach out to Avnish. I've already shared his LinkedIn profile link in the chat box, so please do reach out to him. I believe he's more than happy to help you all. So
sure.
the last question, I can see. Avdut is asking, looking ahead, which emerging AI capabilities do you think will have the biggest impact on healthcare delivering in next 3 to 5 years?
So if you're talking about emerging technologies, and GSDC also has a lot of courses on other emerging technologies. One emerging technology which fascinates me is the combination of quantum computing and AI, and this is going to definitely change the game. The way we are talking about generative AI and AI today, which is like the date is 7th of October 2025, and if we are able to build some kind of quantum computing and merge it with AI in times to come, that is going to be revolutionary, because it's going to allow you parallel computing in multiple scenarios. So healthcare is all about scenarios, right? You do a lot of training in scenarios, uh, and whenever you are looking at a patient or handling some kind of emergency, scenarios are going on, you are trying to assess. So if you are able to have that kind of computing coming with AI in future, that is some emerging technology frontier which I look towards, and it is going to definitely set us on a different path. Reach out to me on LinkedIn to have a long discussion on this.
Absolutely. Yes, thank you so much, Avnish. I believe we have done with the questions as of now. So before I move forward, I would like to thank you again for this insightful session, and would love to hear final thoughts from you for all the participants today.
Yeah, so really excited, and always excited to talk about AI, and thank you again to GSDC and to you for coordinating this session, and thank you to all the participants for joining on a weekday evening and listening to this. I hope you have gained at least one or two things out of this webinar, which will help you in your generative AI journey in healthcare. And looking forward to interacting more with all of you on GSDC as well as other platforms. Thank you so much.
Thank you, Avnish. Thank you so much for kind words. We'll be definitely reaching out to you again for if any webinar, in case if we schedule any webinar related to healthcare industry. Thank you so much. And as I mentioned in the chat box earlier and announced that we have some great offers. So this is regarding the certification, today's feature certification on GSDC Certified Learning Implementation Generative AI in Healthcare. You can opt out for this certification. You can use this promo code, which is healthcare25, to get amazing discount on this particular certificate. As you all must be aware, whatever the certification GSDC provides, that comes with a lifetime validation. With that, you'll be getting learning resources where you'll be getting a lot of case studies, e-learnings, and book of knowledge. Also, these certifications are lifelong learning, which gives you learning flexibility, and you'll be getting chance to connect with our training partner channel, and also you'll be having a lot of opportunity to work on the capstone project, that is something real time AI simulation practice. So do grab this opportunity. I've already shared the offer details, the promo code, and the link in the chat box. You can check it out. We are providing 25% discount on this particular certification, so do grab this opportunity as soon as possible. So this is something utility tool we have introduced earlier. So this tool will help you to improve your LinkedIn profile score, your AI skill score. You can use this promo code, which is August 100, to get 100% off, and this is only for our webinar attendees. So do grab this opportunity. I've shared the utility details in the chat box earlier. I can share it again if you want. So check it out and do grab this opportunity. And let me make this announcement. Tomorrow we'll be having another session with Junaid Kalia. He's a founder at SaveLife.ai, and he'll be taking us through the topic, that is artificial intelligence in healthcare, distinguish value from hype. So please do join us on 8th October 2025, that is tomorrow, with the same time slot, that is 8:30 a.m. Central and 9:30 p.m. Singapore time. We do have this incredible panel assigned for the session, the another webinar series we are conducting on solving learning's effectiveness challenges in instructional design. This has been scheduled since 6th October till 10th October. So please do join us for the remaining session, or you can refer your friends or colleague who are in the same profession. It might help them. Also, we are running this AI tool challenge. We have scheduled this earlier for 33 days. Now we are planning to extend it, and we will be updating the new dates for this session. It is been started since 18 August onwards with the different time slots. So there will be a slight changes in the time slot. So we'll be updating you the dates and the new time zones, time slots for this. So please do join us over the WhatsApp group. I've shared it in the chat box, so you'll be getting the daily update on these sessions. Thank you very much. We do have these three winners who have referred maximum people to our this session. So I just want to show you all how you can check the leaderboard, where you can check how many points that you have earned so far by referring maximum people to our session. Just allow me a 1 minute. I'll quickly show you. Here we are. You just have to simply go through our website, and you can just access our event web page, where you can see the session that we are conducting right now, and this our incredible panel of speaker aligned for this series. Just scroll down little bit, you'll find the search tab. Here you can search your name, and you can find your name here, and you can see how much points that you have earned. So please do refer maximum people to our session. So, referring people to powerful and knowledgeable sessions like this, you're already taking a step ahead and becoming a thoughtful leader. So, Avnish was one of the leaderboard winner for our prompt engineering session, and today we have sent him access the worth reward that is $400. So, please do refer maximum people to our session and be the winner and get the rewards. So, coming back to the main slide. If you want to be our speaker for our any upcoming events or webinar, you can definitely reach out to us, as we do have platform learning capsule webinars and the podcast. So feel free to reach out to out to us if you want to be speaker as a for our upcoming events as a featured global speaker. As you all know that we'll be having this global platform for all of you. We would love to connect with you all over the LinkedIn. You can scan this QR to get in touch with over the LinkedIn. You can check our website to check all the details, information that I've mentioned regarding the certification. Also, you can get in touch with our learning advisor for more information on the certification in order to opt out for the certifications. Also, you can connect with us over the WhatsApp group to get daily update on the events, webinar, boot camps that we do conduct. And please do not forget to share your session takeaway and the learning outcomes on the Trust Pilot. You'll find the link in the chat box. Thank you everyone for joining today's session. I hope to see you all for the remaining session as well. Until then, keep learning. Take care. Thank you very much, Avnish. Bye. Take care, everyone. Good night.
Bye. Good night.